system, we need to ensure that our system and identify our system and the role of our system in the common diseases of a country, whether it addresses it or not. The third component is an access. Although we say that our country is using about, our country people are using about 70 percentage traditional medicines, the access is not equitable. So we need to provide an equitable access in terms of geographical and financial, that is availability and affordability. The fourth one is the rational use. We need to ensure that the healthcare providers are qualified, we have well registered and licensed product. There should be good communication between traditional medicine providers, allopathy providers, and also the patient. And last but not the least, we should also make sure that we give out reliable scientific information to the public regarding the use of our traditional medicine, what to use, what not to use, how to use, etc. So there's a global status of integrative medicine. As I've said before, China have achieved integration long ago, and it has ticked all the four components as envisaged by WHO, right from a national policy to that of human resources, education, and access of healthcare provider, and even insurance. Moving on to India, currently we are an inclusive approach. That means we have accepted our traditional medicine, but it is not incorporated. The two challenges for us to to get into an integrative system that are in terms of access and health insurance. Although other countries are also in an inclusive system, we have progressed so far from other countries because we have a good national policy. Now, this is an Ayush annual report 2018-19. We can see that amongst the 7 different health systems, the traditional systems that we have, Ayurveda have progressed immensely in terms of research, in terms of educations in hospitals. Second comes homeopathy. There are other systems as yoga, Unani, naturopathy, and Sovaric, but the latest addition, which needs to work a lot so as to meet an integrative system level. Now, Ayush and NRHM in 2005 envisaged this policy of co-locating Ayush doctors into rural areas. This is a 2017 report of it, which says that co-location rate is more in district areas and it serves more number of population, rural population, rather than in community and primary levels. These are the states which have achieved co-location better. Now, as I am from Kerala, I would like to remind you about the status of Kerala. We have good quality of life index and good health indicators when compared to other states. And Ayush has a lot of role in Kerala. Right from the starting setup of Ayush department, within a year of setup, we have our Kerala health policy on Ayush. We are the third largest in terms of Ayurvedic hospitals and second largest in terms of homeopathic hospitals. We also have a public sector manufacturing unit for Ayurveda and also homeopathy. And most importantly, our traditional medicine therapies are insured under the RSBY scheme. There are also a traditional knowledge development cell for IPR protection. We have a separate drugs control unit for ASU drugs. We also have achieved the accreditation system for Ayush especially. And the two things which are promising is that in the 2018 draft of Kerala State Health Policy, an Ayush drug policy and a Center of Integrative Medicine is proposed. Although Kerala have ticked all the major components of integrative medicine as per its WHO, we have a long way to go to expand to its full potential. As I've randomly picked up other states as North, East, West, and South zones, I could find that the progress is slow but yet highly promising. And it also be noted that there is a lack of policy, state policy in these systems, and the lack of health insurance that might be keeping them a little back for now. Okay. Now, there are other integrative healthcare initiatives, and a pilot project was done of India's experiment in integration, and the WHO and Harvard universities are currently studying this, and usually will come up with a report soon so we can understand what are the challenges there. And finally, we'll see what are the 4 challenges that we currently face so as to achieve an integrative system. I'll be mentioning that in terms of the components I've mentioned before. First, in the health policy, although collocation has been mentioned, the collocation strategy is not mentioned in our Ayush system. And although there is a bridge course which is mentioned, lot of medical organizations are against it. And we say that the budgetary allocation to Ayush is not very proper when compared to allopathy, but how many of the states have utilized the Ayush budget? So that is also questionable. And most importantly, universal health insurance is also an issue, and that need to be set up. In terms of safety, quality, and efficacy, although we have GMP and GCP, Schedule Y in terms of new drug for Ayurveda and Schedule Z in terms of clinical trial for Ayurvedic drugs are still not made. The pharmacovigilance cell also needs further strengthening. We also have a disparity relating the methodology that we use in terms of clinical evaluation. So a clinical research into use of traditional medicine for treating our country's common health problems, that should come up. And in research, we have very less research on cost effectiveness or affordability of our traditional medicine. So that has to come up, and lack of research in the implementation and effect of traditional medicine in the local healthcare settings, in the grassroots level, that has to come up. In terms of access, although traditional medicine practitioners are recognized, we need to upgrade our knowledge and skills. And also there's a lack of paucity of data regarding the access and affordability of traditional medicine. And if we are promoting access so much, we are over exploiting our resources. So a sustainable cultivation of a medicinal plant should also be a challenge in front of us. Although in rational use, training guidelines have been published by Ayush in their website, we need an improved communication and a cooperation between the traditional medicine providers and the allopathic doctors. And we should also roll out reliable information for the consumers who use these therapies and products. In conclusion, I'd like to say that integrative medicine is a concept, and we have to take that concept and use the components as envisaged by WHO and convert it into integrative health system. Currently, India is struggling to achieve the component goals. It might be because of the varying level, the disparity in Indian states regarding implementation of a policy and enforcement of regulation. So the two main components that we need to focus on are health insurance and creating equitable access. Without knowing what to be integrated and what not, we finally create a healthcare system that costs more, is less safe, and doesn't do much to our population. Without the proper knowledge or appropriate knowledge, we can say that it can make our Ayush system detrimental. So the need of the hour to do an integration of Ayush into main healthcare delivery system as envisaged by WHO strategy and national health policy. As Susruta envisaged it like so years before, he said that a Chikilsaka should be Bahushruta in Shastra and practice Ayurveda. I'd like to thank my mentor and guide, Dr. Rajmohan, for helping me with this presentation. The PowerPoint presentation is based on Elsevier guidelines. These are the various references. Thank you so much for listening to my presentation patiently. Thank you so much.
Congratulations, Dr. Krishna Beni.
Thank you, sir.
At this juncture, when we are discussing about integrative medicine, recently I have come to know through WhatsApp messages, etc., that the IMF Kerala has issued guidelines, don't use Ayurvedic medicine without going into detail. Do you find that this is a great challenge in implementation of integrative medicine?
Yes, sir. As I mentioned that the bridging course and the mandatory bridging course that is proposed by NRHM, the thing is that IMA is very strong in Kerala and they are opposing the cross-practice system. Can I continue? Yeah, a cross-practice system. And although in one side, NRHM is saying that we need to co-locate Ayush doctors into the facilities, the latest NHRC report mentions that the co-location is just a substitution and it is not giving the Ayush healthcare professionals to excel in the Ayush system. Usually the Ayush professionals are just substituted and they practice they do cross practice also. So we are not
Welcome,
having
Doctor.
enough skill or training to practice allopathy system. So co-location is one of the aspects, and although it has positive things, it also has a negative thing. So mainly, I guess NRHM proposed a bridging course so that training can be given to these mid healthcare providers like Ayush professionals to compensate into that of allopathic system. Example of that, I guess, skilled birth assistance and neonatal resuscitation units. In those areas, Ayush professionals are trained. So I guess it is a both positive thing and negative thing, like two sides of a coin. It makes us stronger in practicing Ayurveda, because we are challenged to practice, we are not denied to do a cross practice. So we will find out that okay, in this emergency management what we can do, if in this what we can do, so it strengthens our systems in one way. So I do find the challenge a positive one.
Thanks, Dr. Krishna, for bringing out many facts in your presentation.
Thank you, sir.
Just a question from my side. Whatever the challenges are there in integrative medicine, globally or in India, whether acceptance, non-acceptance by the various bodies and government and various organizations are working towards that.
Mm.
So I would like to know your message to the young crowd, your friends who are doing the undergraduation or the post graduations. What the message